Welcome to Nursing Xpress. Nursing Xpress. Yes! Now is your time. Let's jump right into your scenario. Glad you're back for another scenario. You're on the clock. A simple one. Here we go. Help me, nurse. There are 4 patients on the floor. Which patient will the nurse report to the HCP immediately? All right, so this looks like a priority question. That's right. So the priority can be anything, but I still challenge you to think of some answers that might appear. What are some important things you'd want to tell the HCP? All right, so here we go. A patient diagnosed with emphysema has a partial pressure or PaO2 of 83. B, a patient diagnosed with pneumonia has a carbon dioxide or CO2 of 34. C, a patient who has had a resection of the prostate or TURP has mild bleeding for 12 hours. D, the patient has completed a total knee replacement and has a hemoglobin of 8 and a hematocrit of 29. Looking at the answer choices, it's pretty obvious. We need to have a good idea of the normal lab values, right? And normal outcomes of certain things. And see here, it's not a lab value, but it's within hours, and we're talking about bleeding within hours. So let's take a look, think about it. Which answer do you think is the most important, the priority to tell the doctor that we need to take care of right now? All right, so you got it? The answer is D. That's right, D. All right, so that hemoglobin is a little too low, and the hematocrit. So before we go into that too much, I want you to understand that the other choices are what we consider least important, of course, but also these are things that are expected for the most part with them. They're not things that need to be addressed at this moment. For example, B is a little low, but it's not that serious. Let's keep looking into this situation and let's find out why the answer is what it is. Yeah, I know. Some of you are looking at this like, ouch. But this is what we call the transurethral resection of the prostate, or TURP for short. Basically, what they're doing is taking out some tissue to reduce the size of the prostate. As you can see, it's pretty invasive. So it's normal for some blood to be coming out of the urethra even 12 hours later. So no surprise, nothing to be shocked about. It's normal. Look what we have here, a trusty blood gas chart. If you remember the answers, we saw CO2 and PO2. And the P just stands for partial pressure. You might see it as PaO2 or PaCO2, okay? So remember these numbers. Don't forget them. Keep them in your memory banks, okay? Save them, write them down, have your notes ready, and have them good to go for next time you see them. All right, so I want to also mention that PO2 is not the same as SaO2, which is measured with a pulse oximetry device. Okay, so as you can see, PO2 is here 80 to 100, but SaO2 is 95 to, what's that? 95 to 100%. So it's a different reading. Don't get them confused. Ready for the next? Let's go. Okay, so you thought the TURP was bad? Get a load of this. That's right. That's a total knee replacement. Do you see how invasive that procedure is? That's why we really have to look at the hemoglobin and hematocrit. A lot of blood can be lost during a procedure like this. Wow. When an invasive procedure like total knee replacement or TKR is done, we want to make sure that the blood is still flowing within the person's system, within blood vessels, and going in and out of the proper places. But when you have things like TERP, you might have a little bit of trickling of blood coming out here and there. But we're still, of course, going to monitor our patients. But when we're worried is when blood is gushing out and just pouring out from anywhere. It doesn't mean you physically see the blood gushing out. It may be internally that the blood is rushing out. And an indicator of the blood coming out like that would be our hemoglobin and hematocrit. So we got to pay close attention to that. Okay, let me put my super smart voice on. Hemoglobin is a protein responsible for transporting blood through the body from lungs to body tissues. It's made of heme and yeah. Yeah. Okay, so you know what hemoglobin is already. You know all that science stuff, right? So you tell me, what's the normal lab value for hemoglobin and hematocrit? I'm waiting. So, for those that don't know the normal hemoglobin and hematocrit level, I got this little picture here. It's a clue. A bunch of kids, right? A whole bunch of kids. How old would you say they are? I see them as teenagers. They're in their teen years, right? So teenage years are between, yeah, about like 12 to 17, yeah? That's right. So what does that tell us about hemoglobin? It's about 12 to 17. It can vary a little bit with age. As you can see, men are a little higher at 13 to 17, women 12 to 15. But overall, remember, it's 12 to 17. That's where we would like that hemoglobin number to be. Now to remember hematocrit, don't forget, usually it's a little bit over 3 times the hemoglobin result that you receive. Just a little tidbit just to help you out, help you along your way. Let's keep going. Well, I hope you memorized the normal hemoglobin value. So what's the significance of that hemoglobin number going down? It's important when it's decreasing because it tells us that there may be bleeding or hemorrhaging happening, right? So what do we want to do when that happens? We call the HCP, the doctor, right? We tell them, hey, it's going low. Do we want to do something about it? All right. So if it's not too low, if it's only like 11 or 10, the doctor might just order iron supplements to replace it, help build the blood back up. But if we're talking about 8 or 6 or lower, there's a high likelihood that HCP is going to order a blood transfusion. Okay. So we want to look out for that. Wow. You did well on this one. Nice job, nurse. Thank you for watching. While you're here, hit the like and subscribe button. And don't forget to hit the notification bell to know when we put up more videos. Remember, study smart and keep your process of thinking sharp.